The world is rapidly urbanizing, and in 30 years, over 70% of the world population is living in cities. And that means we are having more and more urban problems like waste disposal, transportation, energy, etc. But fortunately, cities have innovative ways to solve all those problems. We have ICT technologists, and private sector and public sector work together to build smart cities to solve all those problems. And WeGO is here to help the cities. WeGO is a smart city platform for cities, but also for corporates and institutions to share information, best practices, and work together to come up with the best solutions for smart cities. We provide the training programs for city officials. We fund the feasibility studies and pilot projects, and we organize international workshops and conferences. And we also produce smart city toolkits and services like smart city guidelines. We are the only international organization wholly focused on smart cities for our member cities. And we are partnering with international organizations like UN, World Bank, Asian Development Bank, and International Telecommunication Union. So join us to make our cities happier for a happy planet.
Okay, welcome everyone. Thank you for joining us for today's webinar. My name is Chris Joe, and I'm the Corporate Relations and Health Officer at WeGO, the World's Smart Sustainable Cities organization. I'll be your moderator today. The WeGO Smart Health Responder webinar is a series, and we have three different parts to this. This is the second of the three, and very much of a pleasure to have all of you here. Our topic today is exploring effects and results of COVID-19 in the Americas. And the purpose of the series of webinars is to share different measures from around the world, national and local, but also from the private sector, and how they have taken measures to reduce the impacts of COVID-19 and steps cities are taking in the meantime to allow your citizens to get back to a normal life. Today, we are proud to have our participants from around the world, 33 different countries from the Americas, Europe, Middle East, Africa, and Asia, all joining us today. And we're also live streaming the webinar on YouTube. So please feel free to join us there. Also, we will send you all the relevant links after the session, including a link to the webinar recording. Also, for participants who have questions, please ask during the presentations or before the Q&A session. If you don't know where to ask a question, please click the chat button on the bottom of your screen between participants and share screen. And you can type your questions in the chat box, and we will collect them to be answered during the Q&A session. Now, I'm going to spend a couple minutes presenting about WeGO for those of you who are not familiar with our organization, and then we'll give the floor to the first opening remark speaker. So our secretary is based in Seoul, and our president city is Seoul, and we have several different regional offices around the world. We're an international association, and we are comprised of different types of members, the majority of which are cities and other types of local governments around the world, which you can see on the map here. And as of today, we have 208 different members. And the last couple of years, we've been growing in corporate memberships. So we have a number of different private sector partners, which are providing different innovative smart tech solutions to cities. And we help matchmake those. And then we also work with national and regional ICT institutions, academical institutions, and research organizations, and so on. We also work with a number of different partners around the world, including the UN multilateral development banks, like the World Bank, and Asian Development Bank, and others, which are much involved in the smart cities. So next slide. So WeGO has launched a new framework this year called the Smart Health Responder, obviously born out of the COVID-19 pandemic. And the purpose is to offer our members, as well as partners and stakeholders, different services and support for their actions against COVID-19, so that we can all reduce the impact and ensure safety to citizens around the world as soon as possible. The Smart Health Responder consists of three components: data portal, knowledge hub, and smart health assistance. As of today, under the data portal, you can see a collection of different best practices, and these are national and local initiatives that the governments around the world have taken. And we are doing this research in-house here at WeGO and receiving cases from our city members. and we will develop the components by improving the capacity and information sharing with our regional office network and other partners. Next, under the Knowledge Hub, you can see a collection of videos and webinars that we both conduct ourselves, but also that we share from around the world with our partners. So you can see all of those that are upcoming as well as the past ones. And this is a great resource for you to check that out. We will develop this component to also share capacity building materials and tools regarding health emergencies. The last component, the Smart Health Assistant, offers to help cities and otherwise that is in need of medical supplies that's short on PPE, personal protective equipment, and others. We have a number of different partners that we work with, and we try to secure these types of resources for you and your city. Also, we will develop this component to provide members, partners, and stakeholders additional information regarding health solutions from our corporate members and training programs related to health emergencies. So that's the Smart Health Responder. And if you go on our website, you can check out these components in detail. I just wanted to present that as a kind of a background why we're doing this, and we will continue developing the components for our members. Okay, now I want to start with our opening remarks. We have a few different distinguished guests that are with us today. First, we have a recorded video from the mayor of Lima, and he is going to be speaking for his city. Thank you.
Reciban un saludo todos los miembros de WeGO, en especial los participantes del webinar. En el Perú, la historia de esta pandemia se inicia con la identificación del primer caso el pasado 6 de marzo. En adelante, todo el panorama cambiaría en la ciudad. Estamos hablando de más de 10 millones de habitantes o 10 millones de personas. Esta situación compleja nos lleva a gestionar tomando acciones urgentes para preservar la salud de los ciudadanos y reducir al máximo los focos de contagio de propagación del virus. Acabamos de salir de un largo proceso de confinamiento o de cuarentena y durante todo este tiempo siempre hemos buscado garantizar los servicios esenciales de la ciudad, como son el transporte, la limpieza, la seguridad, las labores de fiscalización, es decir, cosas que están vinculadas con el espacio, con el territorio. Hemos realizado también en esa línea mucha labor humanitaria, distribuyendo agua potable en lugares de extrema pobreza o de pobreza. También hemos realizado labores de desinfección en las vías públicas y en las unidades de transporte, aplicando una serie de protocolos en mercados, centros de abasto. Una de las acciones que ha marcado un antes y un después en nuestra ciudad ha sido la creación de un albergue temporal, la Casa de Todos. Pudimos acoger a 122 personas de la calle, en su mayoría adultos mayores. Se ha generado en torno a este albergue pues una gran difusión nacional e internacional y hemos logrado que más de 18 de estas personas se reinserten a sus familias. Esta maravillosa experiencia ha dado pie a que abriéramos también refugios de mujer, casas de mujer para la atención de mujeres violentadas en estos momentos donde hay tanta violencia interfamiliar. Nosotros queremos que ellas sean agentes de su propio desarrollo y el de sus propios hijos o de sus hijos o de sus familias. Y eso es algo que es muy importante y valioso para nosotros. Estamos ingresando a lo que algunos han llamado como la nueva normalidad. En ese marco estamos impulsando el uso de la bicicleta como un vehículo seguro y estamos sumando 46 kilómetros de ciclovías temporales. Todo esto es parte de un enfoque de repensar la ciudad. Y tenemos que repensar Lima a raíz de una pandemia como la que estamos viviendo. Hemos también desarrollado los mercados mayoristas móviles para llevar a distintos puntos de la capital una serie de productos frescos que son del campo a prácticamente la mesa, que llegan del gran mercado mayorista de Lima a un precio justo, porque es el ciudadano el que está siempre en el norte de nuestro quehacer. Recientemente también hemos implementado la campaña de salud preventiva Lima te cuida, que lo que busca es acercar los servicios de salud a la población más vulnerable de nuestra capital. Y en estos momentos también nos alistamos para lanzar una campaña de valores que se denomina Salgamos Bien Lima, Salgamos Bien de esto Perú, cuyo objetivo es lograr cambios positivos en los hábitos, en las conductas, en las formas de moverse de la propia población. Las crisis se pueden convertir en grandes oportunidades que nos deben impulsar a ser mejores personas y por consiguiente para convertir a nuestra ciudad en una mejor ciudad o en una mejor sociedad. Y hoy estamos, según esta definición, avanzando firmes hacia una recuperación al 100%. No podemos nosotros caer en una situación de fatiga. Tenemos que seguir luchando para salir adelante de esta pandemia. Salgamos bien de esto, Perú.
Okay, thank you, Mayor Muniz, for those encouraging words. Next, we would like to welcome Ms. Valerie Bassono, Director of Government of Quebec in Seoul, to deliver her welcome remarks. The mic is yours.
Hello, hi everyone. Okay, so greetings from the government of Quebec. Can you hear me well? It's just always like so strange to be virtual. Is that okay? Yeah, can you, do you hear me well? Yeah?
Yes, we can hear you well.
Great. Okay, let me start. So greetings from the government of Quebec. My name is Valérie Boissonneau. I am the director of the Quebec Government Office in Seoul. Je suis honorée de pouvoir intervenir. Sorry for this, the bit in French. Je suis honorée de pouvoir intervenir lors de cette conférence et j'aimerais remercier les organisateurs pour cette initiative. I would like to first and foremost mention that it is a real honor to be part of such a distinguished group of participants from all parts of the Americas, and would like to convey my utmost gratitude to Secretary General, as well as all the distinguished speakers and guests today. I had the pleasure to speak in person a long time ago at the final roundtable at the International Forum on Transforming Cities for Decent Work, which was held last December here in Seoul. In retrospective, I can now declare the warm memories of such forums and the possibility of meeting face to face. But with this context will come back eventually, I'm sure. Yet, just in a matter of months, the world has been transformed in ways that no one could ever imagine. I do remember my recollection of hearing on the news about the presence of this novel virus in Daegu in Korea and the confinement that came with it. The confinement, because there were no firm confinement in Korea. So Quebec was so far away at the time, and yet there has been no exception. With approximately 58,000 confirmed cases, with around, unfortunately, 5,600 deaths for a population of roughly 8.5 million people, Quebec was seriously hit by COVID-19. We look abroad, both for finding equipment to fight the virus, but also to learn about other countries' own experience. We saw Korea, Japan, New Zealand being able to flatten the curve, as we say, and sometimes even not have any curve at all. And we got some successes in Quebec. Most, if not all Quebecers, started to accept by all the public health instruction, particularly during the lockdown and the after the lockdown lifting. The civil population and health workers responded in large numbers to the call from the government to assist people with the disease. As a bulk of the cases were confirmed in elderly houses, many also volunteered to specifically avail themselves there. The government also communicated clearly, in a very transparent way and very concise instruction, and they kept adapting to the ever-changing situation, making Quebecers aware and informed citizens. So that was very important. Political unity, despite numerous parties and representation, truly helped send a clear and unique message to the population. A common front against COVID-19 could be seen in Quebec at the time, and still now. But through all this, I think we all came to one simple conclusion. We have come to the realization that such global challenges can only be resolved together as one. As such, the emphasis and importance on collaboration between individuals, cities, regions, countries, and organizations must be highlighted. With Seoul's recently concluded Cities Against COVID conference, Korea has been one of the leading countries in sharing knowledge and expertise in the battle against COVID-19. And this has been shown with Korea's recent donation of face mask to the Korean war veterans in Quebec, in Canada, generally speaking. We had the opportunity to attend many seminars on fighting COVID-19, and in each one of them, we learned a lot, of course. And I am sure that this new seminar today will provide us with the most necessary tool to keep fighting this COVID-19. Once again, I would like to express my sincere appreciation for the opportunity to speak and continue the collaboration with WeGO and Seoul, as well as the opportunity to learn and contribute in tackling the pandemic. Let us continue the collaboration in resolving this global pandemic. And to conclude with a message of hope and a bit more French, I would like to quote our own premier, "Ça va bien aller, everything will be okay, everything will be fine." So thank you very much for your time, and have a great seminar.
Thank you, Ms. Valerie Bolsono. Really great to see all the progress that your city has been making during this pandemic, and this great message, and for your time. Okay.
Thank you
Next,
very much.
we have Mr. Ortiz Federico, Secretary of La Plata Municipality, to deliver his welcome remarks and going to be speaking for his city. The mic is yours.
Hola, ¿se escucha? Yes. Bueno. Ok. Distinguidos miembros y socios de WeGo, distinguidos...
Mr. Federico, your video is off right now. Can you turn on your webcam?
Yes. Yes, but I can't because...
Oh, yes, we have you. Okay.
Yes. Thank you. Sorry. Distinguidos miembros y socios de WeGo, distinguidos presentadores y expositores que en el día de hoy participan de este webinar organizado por WeGo, distinguido secretario general de WeGo, tengo que iniciar ofreciendo mis condolencias por el reciente fallecimiento del mayor of Seoul Won Song Park, y les estoy muy agradecido profundamente por esta posibilidad de participar de esta conferencia virtual que también han organizado. Te dejo mi saludo muy cordial y el saludo del alcalde de la ciudad de La Plata. Mi nombre es Federico Ortiz, soy el secretario de Modernización de la ciudad de La Plata, en la República Argentina, y me siento muy triste pero esperanzado por la situación que atraviesa nuestras ciudades del mundo, cada una de ellas con características tan particulares que devienen de sus organizaciones económicas, sociales y de sus características culturales y humanas tan particulares, pero sin lugar a dudas, atravesadas por el mismo sentimiento de lucha contra este flagelo y problemática derivada del COVID-19, que nos sorprende y nos interpela como humanos, como seres que habitamos y compartimos el suelo, el aire y el agua de nuestro planeta. Como también compartimos este sentimiento de solidaridad y hermandad. Deseo fervientemente que este webinar sea un aporte más para estrechar los lazos y compartir la información, experiencias y conocimientos, y de esa forma caminar más juntos que nunca en este objetivo de vivir mucho mejor en un mundo mucho más saludable para toda la humanidad. Could you see the first slide? It is my city, in the first slide, our city. La ciudad de La Plata tiene casi 900.000 habitantes y también casi 1.000 kilómetros cuadrados de superficie, siendo la cuarta ciudad más poblada de la Argentina. Fue pensada y diagramada desde su fundación y nacimiento en el año 1882, simétricamente en bloques de cuadrados de 100 metros de cada lado cada uno, con espacios verdes y plazas cada 6 bloques en todas las direcciones y en forma original, atravesada íntegramente por diagonales, las cuales le dan uno de sus apodos, Ciudad de las Diagonales. El día 20 de marzo de 2020, el presidente de la Nación establece la cuarentena obligatoria en todo el territorio nacional de la Argentina, la cual permanece hasta la fecha en lo que se refiere al AMBA y Ciudad de Buenos Aires, que es el estado donde se encuentra mi ciudad. Hubo flexibilizaciones de actividades en el tiempo, pero una de las características peculiares que rodean estas ciudades son los llamados barrios populares. Barrios que se fueron formando y que tienen características de pobreza económica y hacinamiento. Esta característica particular de mi zona, cuya población asciende a casi 18 millones de habitantes, ha hecho que se tenga que retroceder en este tiempo a la fase número 1 y se mantenga la cuarentena. En este contexto, la Ciudad de La Plata debe afrontar el problema, y con 3 decisiones o marcos contextuales que la limitan. La fase de cuarentena solo la puede decretar el gobierno nacional, no hay autonomía. La cantidad de test son determinados por el gobierno nacional, y los 11 hospitales y 39 clínicas privadas que están en la ciudad, ubicados geográficamente, son administrados y decididos por la provincia. Es el estado mayor que contiene la ciudad. Entonces, dados estos condicionamientos, nosotros diseñamos nuestra estrategia y nuestro campo de acción para la ciudad. Next slide, please. Teniendo en cuenta que no se posee hospitales municipales propios de la ciudad, tenemos lo que se llama vigilancia epidemiológica a través de las siguientes instancias. Primero, detectar. Plan detectar. Se dividió la ciudad en sus 26 barrios de forma geográfica, organizando comités en cada uno de ellos, con funcionarios de la ciudad, líderes de asociaciones civiles, instituciones, comercio, industria e iglesias, distintas religiones, quienes harían un seguimiento mucho más cercano en cada barrio e interactúan con los 46 centros de atención médica primaria que tenía en la ciudad. También se habilitaron líneas y mensajerías 24 horas online, atendidas por médicos para asesoramiento y denuncias relacionadas con la temática de COVID-19. Y por último, se hacen operativos de detección y test geográficos en lo que denominamos zonas calientes. Luego, segundo, con estas detecciones y confirmándose o descartándose los casos, se hacen los trazados y vínculos de los positivos con su árbol de exposición, con sus vinculaciones, aislando de forma preventiva según el caso y la gravedad, en sus casas o en centros de aislamientos que fueron creados especialmente para este fin, para los casos más leves. Si el caso es grave, van a alojarse a los hospitales. Si no se lo aísla y se lo sigue a través de un software creado por la ciudad que geolocaliza y vincula todos los casos que se vinculan y a las personas que se vinculan con él, y arroja información con un análisis sistémico que interrelaciona toda la información de interés, como pueden ser localizaciones de geriátricos, centros médicos, barrios populares, transporte público, personal sanitario y otros. Hoy en la República Argentina hay 141.900 casos confirmados en total y 2.588 personas fallecidas, mientras que en nuestra ciudad, la ciudad de La Plata, se han detectado desde el inicio de la pandemia, el 20 de marzo, 2.172 casos confirmados y 41 personas fallecidas. La tasa de duplicación se da cada 15 días. Así que esto es todo. Seguimos trabajando. Muy agradecido por su... de last slide, please. Muy agradecido por su tiempo y por esta exposición.
Okay, thank you, Mr. Ortiz Federico, for your remarks. So before we move on to the presentations, I want to allow our Secretary General, Mr. Kyung-Yeol Lee, to also give a few remarks. Okay, the mic is yours, General Lee.
Thank you, Chris. Good morning and probably good evening. How are you, WeGO friends and partners? My special thanks go to His Excellency Mayor of Lima, who sent us a beautiful message amidst the hard time tackling the virus. Well, I also joined Mr. Ortiz to pray for our recently departed president, Mayor Park of Seoul, who devoted tremendously for the development of WeGO. Well, despite the current pandemic situation, I remain optimistic. We are great human beings, so we can solve problems, however serious they are. The question is how long it will take and how many will fall victim to it. Of course, we want it to go away as fast as we wish and with minimum fatalities. And it depends on how we tackle the challenge and what means we possess to fight it. But unfortunately, we don't have weapons to disable the virus yet. We need some more time. So what we have to do now is 3 Ps: precaution, prevention, and preparation for the future. By avoiding the virus for a while, we buy time for invention of vaccine and medicine, and possibly a novel way of living. Here, transnational collaboration becomes instrumental. We need to put our heads together to save human lives and human civilization. COVID-19 has a big silver lining. It testifies that smart technology and digital government is the key to fast and efficient response. We are witnessing many best practices around the world: early mass testing and sequestration, smart social distancing and smart applications, online education and remote healthcare services are prominent examples. We need to share those knowledges and policies to make people healthy and happy. Well, WeGo is a smart city organization. And as you might have heard me before, a smart city is a happy city for smart people, Homo sapiens. A smart city means nothing if people are not healthy or happy. So smart city means happy city for Homo sapiens. So WeGo launched the Smart Health Responder program, this one, and many WeGo events and programs this year have been either postponed or canceled. For some time, we will focus on two tracks. This Smart Health Responder is the one, and the other is called Smart City Driver. It designs your smart city online. You can do it online at your office, and I strongly encourage all of you to look into that. Well, for WeGo members, I take this opportunity to announce that our annual executive committee meeting will be online sometime in the fall. The details will be consulted and notified soon. Having said that, I welcome you to the second session of our Health Responder program. And we will meet online like this for a while, but I hope we will see you soon in flesh and blood. Please stay safe and healthy, and I wish you 10,000 happiness. Thank you.
Thank you for those wonderful remarks, Secretary General Lee. Okay, now before we start with the presentations, I just want to remind all participants to please turn off your webcams as well as your microphones so that only the presenters are showing right now. I think the presenters all turned off their webcams right now, but I think the presenters can turn on the webcams, but just mute themselves before they present. Okay, so we're going to start the first set of presentations from the Latin American cities. Mexico City and Sao Paulo will be sharing their preventive measures towards COVID-19 and what these cities are doing to look for the post-COVID-19 era. So let's start with Mr. Jose Marino and Mr. Marino Munez, who will be speaking 5 minutes each. Mr. Marino is the head of the Digital Agency for Public Innovation under the New Mexico city government and in charge of open and digital government, technological abbreviations, data policies, and connectivity. And Mr. Muniz is in charge of the project coordination and communication of the agency. We will begin with Mr. Marino for his presentation. Mr. Marino, the mic is yours.
Thank you, Chris. I'm going to be quick. I just want to give you a summary of what the city has done in terms of the response to the coronavirus challenge. And basically at the very beginning, in mid-March, we had the first case at the end of February. And by the beginning of March, we already had a daily meeting with the mayor just to cover what the response of the city should be. And we had pretty much four main questions at the time. One was what is the reproduction rate in the city, like an estimation, so that we could build an epidemiological model. Two, how much capacity we have to build in terms of like our health system. And three, how can we discriminate among cases so that everybody gets proper treatment, but not everybody runs to the hospitals. And four, how can we be aware and ready for all the cases, like those who remain at home, how we're gonna check on them so that they can be translated to a hospital as quickly as possible. So the challenge in terms of the city are many. We are a 9 million city, a 9 million people city, but we have a daily inflow of 5 million people, which by all measures makes us a 14 million city, and the whole metropolitan area is 22. There were information constraints in terms of technology access. We have a very fragmented health system, and half of the population works in the informal sector, which means they don't have access to good quality health services. And we have to increment very quickly the ICU capacity in the city. So the first step was to build the epidemiological model. If you can move to the next slide, please. And this is what we created. We haven't changed the parameters of the model since mid-March. And as you can see, the epidemiological model actually fit very well. And what's different about this model from other models in the country is that we're not using tests or cases as the main input of information. We're using hospitalized cases as the main input of information. And that, because we don't have as many tests as many other cities, so this was a very cheap way to access relevant information. And as you can see, we passed the maximum by the mid-end of May, but this was very clearly a good tool to help us respond to the pandemic. And it's still a very useful tool. We're still using it. Next, please. That was people on ventilators. I'm sorry, the previous one was people without ventilators. This is people on ventilators, which the actual level in the city was actually below our more optimistic scenario. Next, please. Second, to discriminate among users, we built an SMS system where we would have a set of questions, and then we would classify different types of patients. And then we have Locatel. Locatel is the call center in the city. It depends, it's within the agency. And it has 600 operators. So whenever we found a suspicious case or with serious symptoms, a medical personnel would call from Locatel to make sure about the veracity of the information and the gravity of the symptoms. And then it would either be canalized, moved to a hospital by its own means, if it's not an urgency, or by an ambulance. And to allow people to actually remain at home while sick, if they could leave the sickness in their houses, we deliver a medical kit with economic support and groceries. Mexico City is a prosperous city, but it's also a very unequal city. So there is a big part of the population that actually have, a daily struggle to make ends meet. So it is important, we're asking them to remain at home to actually provide the food, medical, and monetary means for them to be able to do so. And just recently, we started a program of contact tracing. We're not using an app. We believe that the use of apps for contact tracing has still been successful just in very few cases with very specific conditions. What we're doing is we have access to the data of positive cases every day, so we make phone contact to them. If they accept the questionnaire, then they give us the name of other contacts. So far, we have reached 12,000 contacts, and almost half of them have turned out to be positive. So this is a very labor-intensive contact tracing system, but I think is better fit for the conditions of the city, and it allows us to actually identify a lot of people. If you put the 12,000 people contacted and half of them positive, which would mean 6,000, that's 60% of the active population of COVID positive in the city right now. So it's been a very successful program. Next one, please. So this is how the contact tracing system works. As you can see, it's more labor intensive than technologically intensive. Of course, there is technology behind it, but we send home almost all of the public servants in the city. So we habilitated the call center to actually expand. So we have 1,500 local public servants who are doing the job along with Locatel, and that has allowed us to keep this space of contact tracing. And we added a program on the very specific clusters within the city that concentrate cases, which implies moving a little health office into these neighborhoods and providing PCR testing. So I would close here, but like the main lesson I think from Mexico City is that there is different ways for developing countries and cities to do things. We don't have to just copy and paste what other cities are doing, because we have very different conditions. We don't have a cohesive health system. We don't have a cohesive social welfare system. We don't have the internet penetration you have. We don't have the access to testing that you had. So we have to improvise. And so the way we did this is in the way I presented it. And I think like innovating and having technological solutions in the midst of crisis does not necessarily imply very sophisticated technology. It just implies being creative and providing care for those who need it the most. And I'm gonna ask Mariano, who is the project manager at the agencia, to give the rest of the presentation. Thank you very much.
Thank you very much, Pepe, and nice to meet all of you. Thank you very much, Secretary General. So if you could please change the next slide, just to talk about what else are we doing in the city related to this reopening phase. As Pepe mentioned, we are using the percentage of available hospital beds as our main indicator for the pandemic. And we implemented a traffic light system to gradually return to our normality, to this new normality. We could say that Mexico City probably had the most strict and gradual return to our normal activities. We actually nowadays are under the orange traffic light, which implies we're under a capacity of 65% of available hospital beds. That implies that during the first part of the reopening phase, only essential activities such as primary activities, the construction sector, were allowed to be again into the economy, with of course strict measures. One of the main advantages of having some months of lag for our first case in terms of other European or Asian cities is that we could learn from what other cities were doing before we had new outbreaks. And for example, when we allowed the return of restaurants in the city during the orange phase, that implied that we implemented a very strong and aggressive program to have outdoor dining, not in outdoors, and to be in advance, for example, into air conditioning measures or other things that we were knowing day by day, new things about how the COVID-19 spread and how we could prevent it in our reopening. So one of the key measures also that implied our reopening strategy was to allow different working schedules to avoid peaks in public transportation and many people in small and closed spaces, and also a very important increased capacity of testing. The city has now reached this started around the end of May and the beginning of June, just coinciding with the reopening of the city. And now the goal is just to have a similar number of tests per inhabitants, similar to that of Seoul. And we're done it by reconverting laboratories, by assuring the flow of materials and other things that we know that nowadays in the whole world have a shortage, but we're doing this, and especially now that we have this reopening phase, as Pepe mentioned, we're also having an complete intervention into clusters and areas that are now having most cases in the city. So I think this is the final presentation. I don't know if we have a last slide, if you can help me, or this is the end. Chris, I think this is the last one. So yes, just to remind you and to sum up what Mexico City has been doing during these months, we use innovation and technology, but as Pepe mentioned, adapted to our conditions. And we hope that we've made all this information available in this website. So if you want to know more about what we're doing, we've also entered some of these projects into our health respondent, and we are available to your questions and answers. Thank you very much.
Okay, thank you, Mr. Marino and Mr. Funes. Mexico City is also a regional office, so if you have any questions, you can also reach out to WeGO, and we can connect you guys with Mexico City. Thank you. Okay, next, now I would like to invite Mr. Victor Cipriano de Fazio and Ms. Fernanda Belbanil, who will also be speaking 5 minutes each. Mr. Fazio is the head of department at the 011 Lab Innovation and Government Lab at Sao Paulo City Hall, and Ms. Marino is the technical director of partnerships. We will begin with Mr. Fazio and his presentation. The mic is yours.
Hi everyone. Chris, I'm not being able to open my video. Okay.
We'll give you the authority to open the video. Okay.
Okay. Well, thank you very, very much for the invitation to be here. And I say that on behalf of the city of São Paulo, of the Secretary of Innovation and Technology, and all the staff of the city of São Paulo. It's an honor to be part of this network and to hear experiences, and thank you very much for your generosity on sharing these experiences. As Chris introduced it, I'm Victor Fazio. I'm a civil servant, and I'm very proud of that. So I always say that. And since 2017, we are here in São Paulo building this initiative. And for those who don't know, São Paulo has around 12 million people, and the metropolitan region has something around 20 million people. So it's very dense, it's very diverse, and a very complicated city, as South American cities and their dynamics normally are. So I want to begin by saying that the we are living in complex times. Being government and making public policy is something very complex, and there is this need for us to develop and disseminate ways to quickly access these problems, these complex problems, and to understand this contextual complexity, as our colleagues from Mexico brought to this table, that we have specific contexts, we have some limitations, we have opportunities, we have different civic dynamics. So it's very important. These kind of networks are very important moments for us to share and to learn from our partners around the world. And well, and how do we do that? Why am I here as a leader of the Innovation Lab to talk to you about COVID-19? Can you go to the next slide? Okay. I'm here because of these. These are some of the problems governments normally have, and I want to tell you specifically now about uncertainty futures. We have been taken by assault by these pandemics, and we are now on this moment to try to reduce the dissemination of the virus, and at the same time explore these possible futures of governments while we build these futures. So we are acting and learning at the same time. And the cases Fernanda is going to present are both part of this effort. So I will talk briefly to you about the lab, and then I will lead to Fernanda to present the cases. So next slide, please. So we are here we exist to try to bring public management closer to people. So this is our mission, and at the same time we try to increase efficiency, the quality of public services, but always looking and doing that centered on people. So we have these three access, design, improve public services, mobilize public innovation communities, and to develop capabilities to innovate. This is very important when we say we are on complex times, and complex problems need to be accessed with different ways, with different tools, with different governance practices, etc. So this is part of what we do. So next slide, please. What do I say about developing capabilities to innovate? We seek to bring about changes in mentality, attitudes, and skills of civil servants, and we do that mainly with projects like people learning by doing, using projects as a platform for people to learn. Next slide, please. And we are this area that brings civil servants closer to problems and to bring these experiences by the population. And we try to connect these civil servants to share practice and innovations. We have many cases about that. You have the opportunity to access that. Next, please. And what do we do by designing and improving public services? The municipality needs to change the way it works to deliver these services and to be more connected with people's needs. So we do that in many ways. Next slide, please. There are lots of competencies we articulate to do that, and we will talk specifically about some of that that were articulated on these two projects we're going to show you. But mainly we are using behavioral insights and design and qualitative methods to build these cases. Next slide, please. And the main point here is to work as a way in a way, we can do projects and experiment and build these futures as we work, as we get to know the realities, we get to know the problems, we iterate with people, and then we can bring this complexity to the governance arrangements of government. So we try to identify these challenges, always with a partner inside the government. We always set up multidisciplinary teams. This intersectoriality is very important to work with in complex problems. And we are always trying to motivate partners to transform the service based on methodologies, and always work on the autonomy of teams, so they can make decisions in view of the value and learnings of the process, because the people in teams are nearer the partners, are near the reality, more near of the reality, so they can access this value with more accuracy. So quickly, this is a brief presentation of what the lab is, and I will leave my time to Fernanda so she can present the cases with a little more time.
Hello, everyone. So thank you for the opportunity. Thank you, Vitor. My name is Fernanda Balbino. I'm the Director of Partnerships of 011, and I'll have the pleasure to share with you 2 of our current projects in response to COVID-19. I think we can have the next slide, please. So I would like to start with the project Working from Home, which is basically a meta language here. And just to share a bit of the context in which the project was born, in March, about 60,000 public servants of the municipality started working from home due to the pandemic. So they were told to work from home in very different conditions, considering physical environment, technological infrastructure, internet connection, and also schools and care facilities were shut down, which means they were not only working from home, but a good share of them, of the public servants, were also taking care of someone, looking after someone, doing house chores. And as the municipality didn't have enough time to prepare for the situation, there was, and there is still, a lack of support for those servants with low digital literacy. And adding up to the situation, there was a lack of training for remote team management, and finally a disruption of performance tracking practices that were not until then adapted to an online setting. And next, please. Even though this context does not look very stimulating, we managed to find some opportunities, and I'm going to mention just some of them to be quick. And I think one of the main ones is cost reduction and the increase of well-being in the public service, a way to accelerate new forms of delivering public services that, for example, were imagined, the public service that were not imagined digitalized before. Now we can dream about it. And of course, reimagine management practices. Next. So finally, what are the purposes of this project? First is to understand the challenges that public services were facing to adapt to remote work. And then is to develop an evidence-based strategy to define who, during the easing quarantine process, should stay home, or those that, if needed, can go back to in-person work. And finally, in the long term, I think our purpose is to create a policy that enables hybrid, remote, and in-person work arrangements beyond the pandemic context. So working from home was not yet institutionalized, is not a work regime in the city of São Paulo, and should we make it available, an option available to the public servants? Next. So how are we doing it? So as Victor said, we're doing in mixing and multidisciplinary teams We're also doing project management based on cycles of exploration, experimentation, synthesis, and this is to allow tests and improvements throughout the process. And we also work with the premise of always testing and collecting data, and to make sure we're just not telling people to work from home, but we're doing the best possible way and offering evidence-based strategies to support them while they're doing so. Next, please. So we conducted a survey to collect civil servants' perspectives on working from home. We had over 4,000 respondents from 4 different municipal bodies, and in the overall, public servants had a very positive perspective of remote work. 41% would like to start working from home after the pandemic, 94% declared to be up to date with their activities, and 78% have the same amount or more tests. Next. And now a bit of the perspective of team managers. So 67% believe their teams are performing better their tests remotely. 93% postulate their teams are well organized while working from home, and 86% believe their teams work well with technology. So those are good insights. Next slide, please. And what else? What else are we doing? This is an ongoing project, so we're still halfway there. We're reaching the experimentation phase, and we're designing a change management strategy. So we're asking people to change the way they've been working for years. We need to sustain these changes and to give them support. And we're going to do so by creating change management practices and using change management frameworks to address this issue. Also, we have identified the main struggles of working from home, and now we're going to prototype solutions that can help out. We also intend to address less conventional agendas in the public sector, at least in Brazil, such as new and modern ways of performance tracking, team management, and adaptable work arrangements. We can think about the rich structures of public sector, and I think we have a challenge here to address all these opportunities. And before moving on to the next projects, I brought us some quotes from the partners. Next slide, please. So I'm gonna read just one of them. In this project, I learned that it's possible to work remotely on complex projects in a collaborative way. I changed my perception of remote work. Now I know that it's possible to do it in a different way. And moving on to the next project, which is behavioral change. I'll try to be very brief about it. As we know, the pandemic of COVID-19 required many behavioral adaptations, and 2 of the main ones were social distancing and wearing face masks. In São Paulo, we had a voluntary lockdown, so there was a need to incentivize non-compulsory behavioral change and to tackle the low compliance to sanitary norms. And we developed this intervention to tackle the situation, which is based on sending SMS based on behavioral insights to the numbers of the districts with the highest rates of COVID-19. Next. The methodology was developed by our behavior insights team. They have the expertise in applying nudge to the public services. And so according to the literature, text messages are effective for changing health-related behaviors. And these so-called nudges are an affordable, cheap, and efficient way to communicate with the population. So we chose SMS because most of the population of São Paulo have a cell phone, and some of them do not have access to data. Next. So the methodology is based on 4 SMS per person with the purpose to inform, instruct, and motivate. And these are some of the principles of the behavioral sciences that we're using in this project: reciprocity, civic duty, social norm, risk aversion, and collective sense. And after that, we ran an impact analysis to verify the best version. Next. Thank you. This is just one example of the message used. This one that focused on the civic duty principle, and it's just municipality of São Paulo: avoiding death of family and friends is your duty. Going outside puts others at risk. Stay at home. Just to show one of the examples of the tests. Next, please. And just the project phases, we sent the SMS to 60,000 people. In the second phase, we ran an impact analysis with 7,000 people, and we're starting now the phase 3 to scale up, we're going to send the SMS to 12 million people in the districts with the highest contamination rates. Next. Thank you. So general conclusions, all versions indicated a positive impact on people's understanding, which implies the ability to adopt the desired behavior. Also, the civic duty version appears to perform slightly better than the other ones, and SMS are ineffective to inform the population. Next and final, what are we taking from this? We consider innovation. The innovation can be a driver to build up resilience and ability to adapt to circumstances, especially in crises such as the current one. We also must consider in this moment as a singular opportunity to close the gap between the people and the government. And last but not least, we have the opportunity and the means to implement new interventions and promote change. Thank you, and sorry for the time.
Okay, thank you so much, Mr. Fazio and Ms. Padrino. Okay, actually we're running kind of late on the time. So for the Mexico City and Sao Paulo, I think we're gonna ask one question each. So, and for Mexico City, I think Mr. Munez and Mr. Marino had to leave because they had a meeting. So I think Ms. Regina Garduno was gonna answer the questions on their behalf. So I think our first question will go to Mexico City. And this is from Maria de las Mercedes Almen from Argentina. Is Mexico City implementing a home office to administrate public affairs? If so, what were the biggest challenges? For example, data security, infrastructure, and etc. And how were they addressed?
Hello, everybody. This is Regina Garduño on behalf of Mexico City. We are, in fact, working from home. All public servants are working from home. Can you see me now?
Yes, we can see you.
Okay, great. And except for the ones that have to provide attention to citizens. I don't know if that answers the question.
Okay, thank you. Thank you for the answer. Okay, next we'll ask Sao Paulo, we'll ask, this is a question from Amir Ali from the UAE. Collaboration between cities, regions, and countries is pivotal in dealing with the current pandemic. Looking at the continuous rise of cases in Brazil, what are some strategies that Sao Paulo or Brazil is adopting to work with other cities and countries to address the pandemic?
So Fernanda here. I think collaboration is key in this moment, and in our projects, we rely heavily on information about similar projects that were being conducted elsewhere in other countries or in other cities of Brazil. And our innovation vision is deeply inspired by other innovation units, especially in Latin America, because of the similar context. And we're permanently in contact with other Latin American governments to develop cooperation and think about the agendas that are critical at this moment, especially improving digitalizing services, methodologies, and democratizing access to technology and spreading out innovation in the public services. So I think those three agendas are key in this moment. And we believe that this is how we can contribute better to bring the government close to people's needs. And one of these cooperation units opportunities is actually being attempted with Mariano from the government of Mexico here. And we intend to exchange knowledge and experiences of our responses to COVID. So especially in regards to digital government and the open government agenda. And I think these two agendas have an important role in this moment where people need the government the most. And we need to be able to communicate and to provide services to them. So at the current situation where the inequalities are being stressed out and intensified, we find that collaborating with all the governments, especially the ones that have a similar context, is the best way we can have to generate new insights and address complex issues.
Okay, thank you, Ms. Balbino, for your answer. Okay, now for our next presenter, we will have Mr. Sander Doller. He is the Vice President at the New York City Economic Development Corporation, where he designs, builds, and leads efforts to expand the New York City economy by catalyzing emergency sectors, developing innovation ecosystems, and forging public-private partnerships. Mr. Dolder, the mic is yours.
Okay, thank you for having me and giving me the opportunity to speak. As mentioned, my name is Sander Dolder. I work for effectively the business development arm for the city of New York. And I work in a group that is, it's called Industry and Economic Innovation Group. So essentially we're looking at how to support different industries in New York, how to diversify the economy, but also thinking about where do we want New York City's economy to be 5 years down the road. And so the presentation today is really going to kind of look at a little bit about our recovery process and sort of what we're thinking about and how we intend on moving forward. So next, please. So as we're thinking about what's happening now, we're understanding that there's a lot of change that's happening in real time. Society is transforming, and as an economic development agency, we need to sort of understand what's the current situation, how it might evolve, and what role we need to play. And so, putting this presentation together, I kind of put it and bucketed the sort of things happening in 4 main buckets. Next, please. So one of them is sort of the culture war that's happening in the United States. And what I mean by that is there's just sort of ideological differences, and given the nature of the United States with a two-party system, it tends to have this like us versus them kind of feel to it, and that is having a significant impact as you kind of read the news headlines in the United States on how society is changing here. Next, please. And of course, given the topic of this webinar, but certainly what's top of mind for most people who are listening, the pandemic has played a huge role in changing New York City and sort of the current circumstances. So just some here, New York City had early on, for North America at least, early on had the most cases by far, and it was the epicenter for quite a while. And so we weren't as prepared as we could have been. And a large majority of the issues happened in April and May. But since then in New York City, it's followed a similar curve that you've seen in a lot of European countries. And we're sort of positioned now where we're really focused more on the economic recovery, but for a long time it was strictly on sort of the health crisis, and so a lot of what we did, just to give a slight context on it, was to build basically local supply chains for medical equipment. So anything from putting together teams to build ventilator systems to other kinds of equipment needed on the front lines of the health crisis. Next, please. So, of course, subsequently, as I mentioned, now we're sort of looking at the economic impact and the crisis, and we realize that it's going to profoundly reshape certainly New York City's economy, but the world over. And there are some industries that are going to be affected in the short term, but some of them have more of a long-term effect. So, some of the immediate things we've already seen is around small businesses, it's around tourism, it's around arts and entertainment. Next, please. And then the fourth one is really that there's, in the United States and in a lot of countries around the world, just rising inequalities. And that's driving in the United States the Black Lives Matter movement, and some of the associated kind of movements that deal with inequalities. You see that with Native Americans in the United States as well. And that's sort of bringing the issue of equity and inclusivity in a lot of the work we're doing and how we're thinking about the economy going forward. Next, please. So now we're sort of at a point where I think it's important to kind of mention that this crisis compared to other crises in modern times is a bit different. So the way we're looking at it is 2008, the financial crisis was one where it was a structural issue that we knew about. And because we knew what kind of structural issue failed, we could plan around it and build a solution around it. Now, given that there are multiple crises, but also a certain sense of unknown, it's important for us that we need to understand that things might evolve, things might adapt, and things might change. Some behaviorals might accelerate, some trends might accelerate, some things might change completely. And so it's important for us to kind of think about that, and I'll go over that in a second. Next, please. So when we look at, so I guess as we're thinking about economic recovery, we're kind of looking at it in the short term and in the long term. And so in the short term, as I briefly mentioned, it's really important for us to learn how to adapt and learn in the moment. So things like getting a better understanding of what's happening across industries, being able to prototype a lot of solutions, and collaboration, similar to what colleagues in Sao Paulo are mentioning, is really vital in this time of uncertainty. And so we're looking, just to give you a sample of the type of things we're looking to do, we're looking to do a few things. So we have a system that captures, we're trying to build a system that will capture the issues that small businesses face. And so we build mechanisms behind the scenes from government to be able to service them. So whether it has to do with loans and financial issues, or marketing issues, or digital issues, those are a mechanism we're building to kind of build a clearinghouse, if you will, for that. But to talk about one initiative in particular, we are about to launch this initiative called Neighborhood Challenge. The Neighborhood Challenge is really a pilot to scale program where we're first focusing on storefront businesses. So that means restaurant, retail, personal care, entertainment, and nightlife. And really looking at we're working with small businesses and working with business improvement districts to understand the challenges they face. And we're inviting the innovation community to propose solutions, and we will prototype and pilot these solutions with the idea of scaling them. So an example there of the type of problem we would look at, for instance, with retail and small businesses, how do small businesses compete with Amazon? And is there a way for us to kind of find solutions to do that? And so that's thinking about the future of small businesses, and that's how we're approaching it there. Next slide, please. And so I'll go very quickly over this, but sort of similar to what the colleagues in Sao Paulo are mentioning, there's a lot of undercurrents happening in society and behavioral shifts. And in order for us to think long-term about the economy, we need to really understand what those shifts are. So just to highlight a few here, one of the biggest ones is digitalization, and that's been happening, but is certainly accelerating across all the sectors, from retail to restaurants to health services at a very rapid pace, to education. And that's going to have a profound effect, we believe, in the long term. So that's something we need to keep in mind. Another thing to keep in mind for us is sort of a move towards more local manufacturing and bringing all parts of the supply chain when it comes to a business and in a more regional perspective. And we see that as sort of a trend that is also accelerating. Next slide, please. And so how does that translate in our economic development group? So quickly on this, it's rethinking how we operate. And so with all these things happening, we're trying to prioritize initiatives that will increase more the economic resiliency. First, it's just thinking about growth. We're thinking about not just creating jobs, which is sort of a traditional economic development metric, to thinking about how do we create wealth. And the last one is really thinking about not just in employment, but also ownership. How does everyone have a stake in a company? And can we do something as an economic development firm to do that? So in terms of specific interventions, we are looking to build initiatives that, next slide, please, that capture some of the following pieces of design. One is we need to design our economy for flexibility. So whether that's retail or restaurants or transportation, it's really our belief that there's going to be a digital version, a physical version, and a hybrid version. And this applies both to private sector and to public sector. So mobility as a service is a perfect example of that. And there's also other things like Paris has a 15-minute city that captures a lot of building flexibility around people's lives. Next, please. The second piece is collaboration. My group has been doing a lot of public-private partnerships, but we see this going really mainstream across all government. And so that, as we were kind of thinking about how does New York City's government evolve, that's a crucial piece to what we're looking to do. Next, please. The third piece is around resiliency and really thinking about factors like reducing our impact in climate change and how that might affect the economy over the long term. So it's not just building an industry, but it's also thinking about reducing our impact and making our city more livable. So that can be, that can mean, you know, as I mentioned, becoming more energy efficient or building those local supply chains around food and build food security. And so one example of that is what Amsterdam's doing, where they're pushing the donut model as part of their strategy. Next, please. And the last piece is really around building an economy that is built for everyone. I think we have slowly gone along this ideology over the years, but this sort of amplified because of the crisis, where as we're developing new innovation clusters or promoting businesses, it needs to happen across all 5 boroughs. And one of the things that is one of the strengths in New York City is just its diversity. And we need to galvanize on that because it's a crucial part of what will make us unique, but also successful in the future. So to wrap it up, as we're thinking about economic recovery, in the immediate term, we really need to focus our attention on small businesses. But in the long term, we need to design for flexibility, collaboration, resiliency, and inclusivity. As those factors are really key for New York City to succeed in the 21st century economy, which will be revolving around digital and around green infrastructure. Thank you for your time.
Okay, thank you once again for your time. I agree with the 4 factors of the design of economy. I think that's very great to hear. And right now, I just want to mention that we are very short on time. So I just wanted to let the next presenters know that if we can kind of please speed it up a little bit, okay? So next, we have 2 presenters from City of Portland, Ms. Elizabeth Perez and Mr. Hector Dominguez. Ms. Perez began working of the City of Portland in 2017 as a Hayfield resident fellow in Mayor Wheeler's office and serves as an intern director for the Office of Community Technology. And Mr. Dominguez is a problem solver, creative and virtual mechatronics, electronics and mechanical engineer with 15+ years of international experience, developing industrial and research projects in all projects of life cycle stages. We will begin with Ms. Perez for her presentation. Okay, the mic is yours.
Great, thank you. So I won't go into more of who I am, but just so everyone has a sense of what we do, we work on digital equity initiatives for the City of Portland. So we focus on making sure people can connect and benefit from technology. We can go to the next slide. So in response to the COVID-19 crisis, Mayor Wheeler and our City Commissioner Hardesty created an economic impact and intervention task force. This was a way to gather stakeholders to focus on issues affecting housing, small business, healthcare, and arts, among other topics. So one topic that touches all of these is our access and use of technology. So for most government services, we predominantly have them available online, and this is even more true through this crisis. So if you're not connected, you don't know what's available, and even if you do, you don't have the access to apply or secure benefits that are available to you. So we were asked to start a work group addressing the digital divide amidst COVID. I want to be clear that we knew what a lot of the issues were before, it just merely worsened the problem. So for the county, we have about 32,000 households that have limited access to the internet or no access at all. About half of that number lack computers, tablets, or critical hardware, and then many more lack knowledge about programs for chats or video calls, online healthcare, banking, and learning. Lastly, so many members of this community have heightened online privacy concerns. So the thing that we thought about is, well, we can't expect people to stay home if they don't have the tools they need. And for high-risk individuals, we put them in a really impossible situation. Their only way of accessing the services is to stay home. So we can do the next slide. We were pretty lucky at the beginning that we received a donation of about 200 Chromebooks from a local distributor. So 100 of them were donated directly to a school district, and then we used the other 100 devices to start a pilot program. And I'm really happy to announce that City Council passed an ordinance yesterday dedicating $3.5 million in federal funding to expand our pilot to serve an additional 3,500 to 5,000 individuals. This will include an internet-enabled laptop, so likely a Chromebook, paid internet connectivity for 12 months, and then we're building culturally specific training with some of our community partners. Based on what we know of who's affected in our population, we prioritized meeting the needs of Black, Indigenous, and other people of color, as well as people with disabilities. So we partnered with our community and culturally centered nonprofits for the kit distribution for a couple of reasons. One, most people we hope to reach don't trust government and maybe wouldn't take a device from us anyway. It also allows the nonprofits that we are working with to continue delivering the services to individuals throughout the pandemic. The main uses we've heard so far from the pilot is that they are using it for recovery support, connection for older adults, counseling, civic engagement, getting pandemic resources, and work training. And then lastly, they serve as the intermediary. So government, we can trust that the governments are getting into the right hands without us having to collect personally identifiable information from community members. This ensures that we get the data that we need, and then also information that is really sensitive stays in the hands of community. And Hector's going to discuss this a little bit more. Last slide, please. So the last piece that I just want to talk about is that a big criticism of city government and government in general is that we wait until the last minute to ask community members to weigh in on what we should do and how we should spend this money. And so we really tried to avoid that with this project. At the beginning of this work group, we made sure that we had individuals from other government agencies, from nonprofits, individual community members, and the business sector to help shape our response. We're now able to scale up and ensure our community members have the tools that they need to stay home now while we look for some of the longer term solutions. So I will hand it over to my colleague, Hector, and he'll talk about our data strategy as it pertains to COVID-19. Thank you.
Thank you, Elizabeth. Next, please. Yeah, well, first of all, thank you so much for having us. I think for me, it's been great to listen what other cities are doing in these times. I really appreciate all the insights and all the lessons learned as well. So in the case of our city, the first thing to understand is that the local government is very segmented. We have the city government, the city of Portland, was surrounded by different government entities independent from what the city does. So as the city, we don't really manage health data. So that's done by the counties, which depend on the state And at the same time, we have this regional government that includes the urban area plus some suburban area plus some rural area around the city. And all that is like different cities, towns, all together. So it's really an ecosystem of governments, relationships, flow of goods, people, and that really makes a collective effort a challenge. So we really need to be collaborating, and that's part of the main focus on our data strategy, building public trust. As part of that, the city is part of this coalition of cities for digital rights. It's been led by the cities of New York, Barcelona, and Amsterdam, and we have been contributing, collaborating, and it's been a space for learning, for also communicating some of the things that we are doing, and then improving quickly right now. So once the COVID-19 hit our city, so we had to change and adapt very quickly. So we put together this strategy that included open data and data sharing with other jurisdictions, and trusted surveillance, working around ways in which we can be collecting data from the communities or different people, and at the same time respect everything about privacy. At the same time, making sure that those who are impacted by technology, they're participating, just as Elizabeth mentioned, are participating in this process, particularly in this crisis. Black communities, Latino communities, farm workers, indigenous communities have been the ones who had the largest rate of infections and the largest rates of deaths. And that's something that we recognize that as a high priority here in our city. Next, please. So for creating that public trust in 2018, we started working on these privacy principles. We got, the city adopted those last year, and you can see they go along the lines of creating transparency, accountability, equitable data management, a full life cycle stewardship, ethical and not discriminatory use of data openness, and making that sure that it's accessible and available. And then we updated these principles. So we added automated decision system that goes along the lines of algorithmic transparency, and making sure that we understand as city, when we procure technology and information solutions, who gets access to that, to our information and information from the community, how that information is being processed, how that information is being stored, where, and how at the end is being destroyed. And then data utility, which means that we are going to just collect the minimum amount of personal information, and obviously sensitive information like biometric data, and that amount has to be well justified. Next, please. So we are starting internal services around data privacy assessment, just to understand what are those risks, the cost, make sure that we are in compliance with all the legal framework and everything that we need to be looking at. And we're talking on issues around housing, issues on economic development, transportation, emergency management, and sustainability, and all that. So every area has its own level of compliance, and so it gets complex quickly. So we are trying to understand that complexity through some procedures and transparency. That comes with a cost, so we need to be agile and integrate that process within the processes that we have and try to evolve from there, and have a clear way to making sure that everybody understand that those services are available for everybody in the city. That's the federalizing these assessments. Next, please. So we have a resource, which is the Portland Urban Data Lake, and those are some cloud services that we are exploring how to use. We already have some on-premise data services where we store some of the city information, strategic information, open data for different things. So it's all, every bureau has its own bucket, let's put it like that, of information. So right now we are trying to consolidate all that, create through the open data program and data governance. We are trying to making sure that people have access to all that, understand what we have. Those are city assets, but not only city assets, but community as well. Next, please. And just to finish, we are participating in that regional effort around COVID-19. That there is a website there where you can see more or less something that is in construction right now, involving equity, communities, climate, environment, economy, and transportation. So we are working with our regional government and counties and other cities, trying to making sure that everything is, we share that information using standards and using the proper channels. And our own city has Portland maps, making that information available to everybody. And with that, we finish. Thank you.
Okay, thank you, Ms. Perez and Mr. Dominguez. I think it's really great to see the progress that your city is doing and the information you guys are sharing with the citizens. So now that our last presenter is Ms. Natalia Mialova, co-founder and CEO of WeVare, also our corporate member. She has a PhD in chemical engineering at University of Toronto, and she has an experience with adapting tech for industrial, healthcare, commercial, and transportation systems. She has been named Corporate Knights Top 30 under 30 in Sustainability, Clean Top 50 Emerging Leaders, and received over 15 awards. Natalia, the mic is yours. Yes, please give us a few seconds. We need to confirm if her video is working or not. Maybe she might have technical difficulties. While we're waiting for her video to come on, we'll just do the Q&A for the speakers, for Sander and Elizabeth Perez and Hector Dominguez. So our first question goes to Sander. This is from Duisevo Ulambek from Kyrgyzstan. We see that the certain economies are addressing COVID-19 better than others. Aside from their economic scale, what are the factors that influence different results in different countries? This is for Sander Doller.
It's a good question. You know, I think that some of what I spoke about in my presentation was around, you know, I think that in the United States, you see sort of the culture war and some of the rising inequalities playing a big factor in the crisis, right? In terms of New York City, for instance, extremely diverse city, but some of the things that played a factor in the response has been that there are hundreds of languages spoken in New York City. So it's not just providing a certain kind of response in English. You need to have translators. You need to be able to talk to different communities. And so that's not necessarily as straightforward as some countries have to deal with. And so in New York City, that's a big thing that has affected how we are handling it and have handled it.
Thank you. Thank you for that answer. Okay, next question will go to Elizabeth Perez. This is from Moshtaba Ghasemi from Iran. Statistics show that marginalized groups have higher rates of infections. So what are the factors that influence this, and what digital solutions can be applied to bridge this gap? So addressing gaps in access in information, infrastructure, services, and et cetera.
Thanks for the question. So I won't claim to be a healthcare expert, but most of us are lucky in that we can work from home. And so what I do know is that many, at least in the city of Portland, of our low-wage workers don't have the option to stay home. And many of those tend to be in our Black and Latinx communities. A lot of those same individuals are the same community groups that don't have access at home. So they have to go out to get the services that they need. So what I will say is that this is really more of a wealth and affordability issue than it is. And so technology isn't necessarily going to fix that. But what can we do? Because, you know, we're putting a lot of our services online and becoming, you know, quote, smart cities. We need to make sure that all of our community members have the same access. And until we can assure that, we need to make sure that our services are available online through other means in a very easy, or not online, but in other means that are really accessible. For the COVID crisis, our response has been really direct, right? We're handing out devices and paying for internet so those people can be connected, but it's a short-term solution and it's not sustainable. As I mentioned, we have 32,000 households that are not connected at home. So even with our best efforts with federal funding, we're going to meet about 15% of those of the needs of those who are affected. Long term, but maybe hopefully sooner, internet in the US needs to be treated like a utility. That would allow us to set rates, set speeds, and service provisions. So, you know, a lot of this is advocacy efforts and a lot of the issues that we need to work with our federal and state partners.
Okay, thank you for that answer. So we have one more question for Hector Dominguez. This is from Brian Cooper from the US. What are the key government policies that enable the use of citizens' data in health pandemics and other emergency responses?
I think we have two key policies. Everything around open data. So just to make sure that we understand that the information that we collect is really for public use. And we here in the US, we have like sunshine laws around public records and making sure that those are available to the public. And the complementary one is privacy. As we understand that holding information and data may actually create some negative impacts from to those from where that information is coming from. And finding that balance sometimes creates some tension. That's why it's not only the policies, but also how we implement those policies and how we resource those policies, not only with infrastructure, but also with talent and people around. And I'm not talking about only in government, but creating an ecosystem that includes community, includes other cities, other levels of government, and other countries sometimes. So it's been, it's really important to not to replicate errors. We can learn from each other very quickly. We have used that pathway in many different times. We are not reinventing the wheel, just simply adapting what we have available. And that's a good thing about working in government and providing some service to people around us, because it's really, we're talking about our own families and neighbors.
Thank you for that answer, Mr. Dominguez. Okay, I think our last presenter right now, she's been having technical difficulties with the internet connection, so she will not be able to join us today. But her PPT will still be shared in the links that we will share. And also you guys can look over the PPT. And if you have any questions for her and her solutions, you can always contact her or directly to us because she is our corporate member. The last question, we have this general question that we want to ask. Anyone who is free to ask this question is allowed to share their mic and their webcam. So last question is from, what general long-term effects of COVID-19 on daily life do you expect, even after a potential vaccine is developed effectively? Anyone can answer this question. Who has the answer to this?
If you let me just contribute, yes. I think it's just moving to the digital world, you know, like like several people mentioned this through these presentations, that it is possible that we can work remotely. You know, we actually, it is possible to do things that before some people didn't think about. You know, we are actually facing new challenges, not only COVID-19, but we have climate change over us. We have all these different social issues around us with equity and demographics, racial justice here in the US and in other places. We live through unique times in humanity, and I think using all these digital tools is a great opportunity to, again, put together our collective knowledge.
Thank you once again, Mr. Dominguez, for that answer. Will anyone have another answer to that? Or if not, we'll move on. Okay. All right, so thank you to all the speakers and to all the audience that stuck around to the end. If anyone in the audience have questions still for any of our speakers or anything that you want to work on with WeGO, we are all here, and these are the speakers on the screen right now with their contacts. And if you would like to get in touch with them directly, you're very welcome to do so. WeGO will have the part 3 webinar focusing on Europe and Africa in late September to early October. So more information will be given as our plans developed. So stay tuned for that. So thank you once again for all of you. And it was great seeing you all here, and we'll see you again here live next time.